Walter got his PSA result, 9.3. His urologist scheduled him for biopsy the following week. Your PSA is elevated. We need tissue diagnosis. Biopsy scheduled. Consent forms signed. Total cost with insurance, $8,000. Walter mentioned the scheduled biopsy to a friend who's a physician assistant. His friend asked, "Did they do any other testing first?" Like what? MRI? Additional biomarkers? Free PSA percentage? Walter checked his records. Just the PSA test. That's it. His friend's eyes widened. You're about to have 12 needles inserted through your rectum based on one number? Without any additional information about whether you actually need it? Walter had never thought about it that way. Shouldn't I just trust my doctor? His friend explained. About 70% of men with PSA between 8 and 10 who get immediate biopsy have no cancer. They undergo invasive procedure unnecessarily. There are tests that can tell you if you're likely in that 70%. Before you agree to biopsy, Walter called his urologist. Can we do additional testing before biopsy? His urologist was resistant. PSA 9.3 warrants biopsy. That's standard protocol, Walter insisted. I want prostate MRI and biomarker tests first. His urologist reluctantly agreed. Results came back 2 weeks later. Prostate MRI, no suspicious lesions. PI-RADS score 2, low suspicion. Free PSA, 27%, very reassuring. Prostate Health Index, 19, low risk. 4K score, 6% probability of high-grade cancer, very low. His urologist reviewed the results. These are all very reassuring. Given this complete profile, we can do active surveillance instead of biopsy. Monitor PSA every 6 months. Repeat MRI in 1 year. Walter canceled the biopsy. Avoided invasive procedure. Saved $8,000. 2 years later, PSA stable between 8.9 and 9.5. No cancer detected. He was in the 70% who didn't need biopsy. The additional testing identified this before the procedure, not after. Today, I'm revealing the tests you should demand before agreeing to biopsy for PSA 8, 9, or 10. The biomarkers that predict if you actually need the procedure, and how these tests can save you from unnecessary invasion and expense. If your doctor scheduled biopsy based on PSA alone, this information could change everything. This video is for education only, not medical advice. Work with your doctor on all testing decisions. This is about informed consent and comprehensive evaluation, not refusing medical care. Individual situations vary. Before we start, comment "Stop Biopsy" below. I'll send you the complete pre-biopsy testing checklist with all tests and risk thresholds. Takes 2 seconds. Now let me show you the tests that should happen before biopsy. PSA between 8 and 10 is challenging range. High enough to raise concern, not high enough to be diagnostic. Studies consistently show about 70 to 75% of men in this range who get immediate biopsy have no cancer. This creates massive problem. Hundreds of thousands of men undergo unnecessary invasive procedures annually. The procedure isn't minor. 12-core biopsy, 12 needles inserted through rectum into prostate. Significant pain and discomfort during and after. Blood in urine for 1 to 2 weeks. Blood in semen for 4 to 6 weeks. Infection risk, 2 to 3% develop serious infections requiring hospitalization. Anxiety, weeks of waiting for results. Cost, $6,000 to $10,000 typically. All of this for 70% who don't have cancer. The question Walter's PA friend asked is crucial. Did they do any other testing first? Because there are tests that identify the low-risk 70% before subjecting them to biopsy. Test 1, free PSA percentage. This should be first test after elevated total PSA. Free PSA measures how much PSA in your blood is free versus bound to proteins. Higher free PSA percentage shares lower cancer risk. Lower free PSA percentage shares higher cancer risk. Walter's free PSA, 27%. Research shows free PSA over 25%, cancer probability about 10 to 15%. free PSA 20 to 25%, cancer probability about 15 to 20%, free PSA 15 to 20%, cancer probability about 20 to 25%, free PSA under 15%, cancer probability 35 to 50%. Walter's 27% put him in lowest risk category. Just this one test dramatically reduced his need for biopsy probability. Many urologists skip this test, go straight from total PSA to biopsy. This is first mistake. Free PSA costs about $50 to $75. Takes same blood draw as regular PSA. Should be automatic with any elevated PSA. Test 2, Prostate Health Index. This is more advanced than free PSA alone. Combines 3 measurements: total PSA, free PSA, and 2 pro PSA. Creates score from 0 to 100. Walter's PHI, 19. Research shows PHI accuracy, score under 27, low risk, cancer probability under 15%, score 27 to 35, moderate risk, cancer probability 20 to 30%, score over 35, high risk, cancer probability over 35%. Walter's 19 was well below the moderate risk threshold. PHI is significantly more accurate than PSA alone. Studies show it reduces unnecessary biopsies by about 30%. Why isn't it standard? Cost: about $200 to $300. Insurance coverage varies. Some doctors aren't aware of it, but paying $300 to avoid $8,000 biopsy makes financial sense. Test 3, 4K score. This test uses 4 prostate biomarkers plus clinical information, generates actual percentage, your probability of high-grade cancer. Walter's 4K score, 6%. This means 94% probability he does not have high-grade cancer. Research on 4K score accuracy. Score under 7.5%, very low risk. Biopsy usually not recommended. Score 7.5 to 20%, moderate risk. Consider additional imaging. Score over 20%, high risk. Biopsy appropriate. Walter's 6% was below the biopsy recommendation threshold. 4K score is particularly useful because it specifically predicts high-grade cancer, the kind that needs treatment, not just any cancer, but clinically significant cancer. Many men have low-grade cancer that never needs treatment. 4K score helps identify men who can safely avoid biopsy. Cost: about $300 to $400. Again, insurance varies, but worth consideration before $8,000 procedure. Test 4, multiparametric prostate MRI. This is the most important test before biopsy. Walter's MRI was game changer. Multiparametric MRI uses multiple imaging techniques to identify suspicious areas in prostate. Results reported using PI-RADS scoring system. PI-RADS 1, very low suspicion. Cancer, highly unlikely. PI-RADS 2, low suspicion. Cancer, unlikely. PI-RADS 3, intermediate suspicion, equivocal. PI-RADS 4, high suspicion. Cancer, likely. PI-RADS 5, very high suspicion. Cancer, very likely. Walter's MRI, PI-RADS 2. This finding alone dramatically reduces biopsy need. Studies show PI-RADS 1 to 2, cancer probability under 10%. Biopsy usually not needed. PI-RADS 3, cancer probability 15 to 25%. Clinical judgment needed. PI-RADS 4-5, cancer probability 50 to 90%. Biopsy definitely indicated. If MRI shows PI-RADS 1 to 2 with elevated PSA, the PSA elevation is almost certainly from benign enlargement or inflammation, not cancer. MRI also enables targeted biopsy if suspicious area is found. Instead of blind 12-core sampling, biopsy targets the specific suspicious area, much more accurate. Fewer cores needed. Cost of MRI, typically $2,500 to $2,500. Expensive. But consider, negative MRI can prevent $6,000 to $8,000 biopsy, plus prevent unnecessary anxiety, complications, recovery time, net savings if you're in the low-risk group. Important clarification. This isn't about refusing biopsies altogether. Some men with PSA 8 to 10 do need biopsy. Biopsy is appropriate when free PSA is very low, under 15%, Prostate health index is high, over 35. 4K score is high, over 20%. MRI shows PI-RADS 4 or 5 lesion. Digital exam feels hard nodule. Rapid PSA increase. Velocity over 0.75 per year. Family history of aggressive prostate cancer. These factors indicate high risk. In high-risk profiles, biopsy is necessary. Walter's profile was low risk across all factors. That's when avoiding biopsy makes sense. The key: know your risk before deciding. Don't let PSA alone determine the path. If your doctor scheduled biopsy based on PSA alone, ask, can we do additional risk assessment first? Specifically request, I'd like free PSA percentage. Can we check prostate health index or 4K score? I'd like prostate MRI before biopsy. Your doctor may resist. Common objections. These tests delay diagnosis if you have cancer. Response: low-risk profile actually rules out significant cancer better than blind biopsy. Insurance might not cover these. Response: I understand. I'll pay out of pocket if needed to avoid unnecessary biopsy. PSA alone is sufficient for biopsy decision. Response: research shows 70% of biopsies in this range are negative. I want to know if I'm in that 70% first. You have right to informed consent. That means right to complete information before invasive procedure. Most doctors will agree if you insist. Some may suggest second opinion. That's fine. Get second opinion from urologist who uses pre-biopsy risk stratification. If your PSA is 8, 9, or 10 and biopsy has been scheduled, stop and ask about additional testing first. Free PSA percentage. Take same blood draw. Consider prostate health index or 4K score. Better accuracy. Request prostate MRI. Most important test before biopsy. Get your complete risk profile. If all tests show low risk, surveillance appropriate. If tests show high risk, biopsy appropriate. Either way, informed decision based on complete information, not rushed decision based on single number. Comment stop biopsy below for your complete pre-biopsy testing checklist with all tests, costs, and risk interpretation guide. Subscribe for next week's video on what active surveillance actually means and how to do it properly for PSA 8 to 10. Walter saved $8,000 and avoided unnecessary procedure. The same comprehensive approach could save you from being in the 70% with negative biopsies. Don't rush to biopsy based on PSA alone. Get complete information first.